Adele, thank you so much for joining us today. When I was asked to think of role models, um, women role models in the field of digital health, you were very much on top of my list. Your work over the years has most definitely very positively contributed to the global health digital transformation. You've been in this field for quite a while. In fact, you and I met, I think, back in 2011 when you were with the UN Foundation already working in this sector. And for the past 5 years, you've been with USAID, the US International Development Agency, and you are now the Senior Digital Health Coordinator for the COVID-19 response. And I'm sure that keeps you very busy these days. You led the creation of the agency's first policy guidance on global health digital transformation. And you also co-created the digital investment principles, which I hope we'll talk about today because those are very important. And as well, you co-authored a very important report, which was called Fighting Ebola with Information, which focused on data and digital technologies at the time. It was a very important report because to me, that was kind of one of the big aha moments when I would say a larger part of the ecosystem realized that the challenge of interoperability and fragmentation really needed to be addressed. So I'm sure we'll talk about that as well. But before anything else, let me ask you this question is, how did you come into digital health? Can you talk a little bit about your path and what led you into this direction?
Sure. Well, first of all, Florence, thank you so much for inviting me to come and participate in this conversation. I really love the idea of women coming together to support one another in their careers. I certainly have been the beneficiary of that throughout my career. And I'm really happy to be participating in this conversation where we think about as a broader community of women, how we can be supporting one another through their careers. My own career path was definitely a serendipitous one. I am not a traditional global health professional by training. I come at this role more from a strategy and policy background. And I started in this space when we met at the UN Foundation, but really took my inspiration from an experience I had when I was in college, and I had the opportunity to study in the newly post-apartheid South Africa as a white woman studying at a historically non-white university. And I was really touched and impressed by how all of the students, I was at the University of the Western Cape, had really deep political views that were very closely held for obvious personal reasons. And they were incredibly active. And I left that experience and went back to New York where I was living at the time and felt like I had this jigsaw puzzle piece of life experience that didn't neatly fit in with the rest of my life story. And it took a while to realize that that experience had deeply transformed me. And that really became the root of my passion for and interest in working in issues that have to do with equity. Earlier in my career, I was working in human rights and focused on international humanitarian law advocacy, and then pivoted as the digital transformation began sweeping the globe, as more and more people in low and middle income countries were having access to cell phones, in particular, to looking at what that digital transformation meant for the international development sector. And so I've had the opportunity to grow with this space as it's grown really rapidly over the past 10 to 15 years. And now at USAID have the opportunity to look at what that transformation means for the way a large global health funder thinks about how it positions itself internally to meet these technical challenges and opportunities that have arisen, and also what it means for how USAID positions its global health work at the country level, and how USAID can best position itself to be a strategic partner to countries as they go through their own digital transformation journeys in the health sector.
Great. Fascinating path. Very interesting. It's always interesting to see how things do happen, like you said, in a serendipity sometimes manner. Because you've been, again, in this field for quite a while, you've seen it develop and transform over time. Can you share with us what you think some of the most sort of seminal moments were, and what were the important lessons that you learned over the last 10 years?
So as this community has grown over the past 10 plus years, we've learned a tremendous amount. And there have been a lot of efforts dedicated to thinking about what are these lessons so that we can make sure that wherever possible, we are building on successes, and where we have made missteps as a global health community, that we are ensuring that we are learning from those lessons and applying them to the future. So some of the pivotal efforts to document those lessons and ensure that the global health community was aware of them and embracing the lessons in order to work more strategically in the future. The first happened around 2012, and this was when a number of global health funders and implementing partners, country partners came together to look at what were the common reasons why technology projects in global health were failing to scale. This became known as pilotitis. Why did we see so many promising innovations, digital innovations flourish at the seed stage, but then when it came time to grow roots and sustain, they would fall away? And there are a number of reasons for this, but there are some very clear common patterns across those reasons. And so the Principles for Digital Development created a list of 9 common causes of failure and re-articulated them as best practice, so that we as a global community can be thinking about how we ensure that that promising practice, best practice, whatever you want to call it, is really ingrained in the way that we design, implement, and build these projects, so that, for example, these projects are, wherever possible, co-created with the communities where they are intended to perform, so that they are fully leveraging the capacities and the strengths of those communities, and that they are designed for the use environment where those technologies will be worked. So that's one example from the Principles for Digital Development. And then 6 years later, there was a new generation of these principles that was developed, taking the Principles for Digital Development, making them specific to the health sector, and then within the health sector, making them specific to health funders. So coming up with 10 things that global health funders can do to address the challenges of sustainable digital systems in countries in use today. 10 things that donors can do to ensure that digital solutions, when they are used, can be sustained and most effectively used in the country environment. And these are called the digital investment principles. And we have now over 30 different global health funders that have endorsed these principles and that are working to integrate those principles into practice within their own organizations. And that's something that I've been working on within USAID in the context of the new USAID Digital Health Vision that you mentioned earlier, this new policy guidance for USAID governing how it makes its investments in digital technologies that support global health programming.
Great. And so that, in fact, leads me to something I'd love for you to expand on. Is it, what are you, in fact, what is USAID kind of focusing on today? Like, where is digital health for you? And talking a little bit about also this new role, right? Because you were on digital health at large, and you're now focusing more on the COVID situation, which, of course, COVID has accelerated all that is digital, not just digital health, but in fact has accelerated digital health incredibly. Things like telemedicine have made more progress over a few months than it did in 10 years. So it'd be great, to tell us more about what's happening today.
Sure. So I am newly in a COVID-19 focused role, which I'm really excited about because I see this as a critical opportunity to be thinking about how we take this new USAID policy guidance around the way we plan for, procure, manage, and use digital technologies as part of our global health programming and apply it to the biggest challenge, certainly that we face in the global health community and perhaps that we've faced as a global community in quite some time. So turning back to the digital health vision, what it does is address that fact that over the past 15 years, we've had a very siloed approach to the way that we've invested in digital technologies based on individual health program needs. So we've had strong HIV/AIDS programs, strong programs for malaria that have each built and invested in their own digital technologies. And this is replicated across a broad number of different specific targeted health areas. And at the country level, this has meant that while there are a number of successful tools that have demonstrated impact and really help accelerate these programs and bring them to a level of achievement and granularity that has propelled those programs forward, oftentimes there are a large number of different digital systems in use, and it can become unsustainable. And so what we are seeing globally is a trend toward the creation of national digital health strategies, where countries are articulating a plan for their digital transformation of their health sector. and common architectures that can bring all these different digital systems together with national level planning that helps enable their interoperability, so the ability of data to be easily exchanged between these different systems, which is critical to getting a holistic picture of what public health needs are in a country, particularly in the context of a fast-moving disease outbreak like COVID-19, and now more recently in the news again, we're hearing about Ebola. So these are really significant challenges. And this move toward the creation of national digital health strategies with accompanying architecture to bring these tools together is a really important milestone in the development of the global health sector and in the digital transformation of the global health sector. So the USAID vision focuses on the need to support and strengthen these country plans, including the policy documents and the technology architecture that helps bring these systems together, to ensure that we understand where countries are in their digital transformation journeys so that we are most effectively and appropriately resourcing them with our investments and with the tools that we are oftentimes co-investing in with countries to support their health systems. And that wherever possible, where we know we have effective scaled technologies, oftentimes they're open source, they can be adapted and reused across a number of different environments, different health verticals, but also different geographic environments, that we should be continuing to support and strengthen and adapt and use those tools. So those are the 4 priorities that are in the digital health vision. And now in the context of COVID-19, we're looking at the need to very quickly support a global rollout of the COVID-19 vaccines, including to hard to reach populations that may be beyond the range of digital connectivity. And so this is a challenge that certainly needs to include smart and strategic investments in digital systems and in country capacity to effectively use and manage those systems and effectively use and manage the data in those systems. But that also has to be built bearing in mind that there are really important segments of the population that will need to be reached in an offline environment. And so building with that full continuum of needs in mind is really critical. And so I think that is one of the big challenges before us as a global community as we think about how to ensure that we are equitably distributing the COVID-19 vaccine.
Yeah, that remains a challenge. Huh? The digital divide is still a reality. We've been talking about it for many years. I know that the WEF and the World Bank and many others, GSMA, and are trying to still work on that, but it's not easy to reach that full equity in terms of connectivity. I think it's still half the world that's offline, so that's quite a bit of a challenge to work with. So can you tell us now a little bit, since we're in a Women in Tech event here, what is your vision of the role of women in digital health?
I see a lot of very strong and promising women leaders in this space, but I also remark that there is a dominance of men in leadership positions, both in the global health sector, but more specifically where you see the intersection of digital technologies and global health. And so I think there's also a lot of opportunity to be thinking about how we support and strengthen one another through communities like this, and what we can do to advocate to continue to create positions of leadership that are available and accessible to women. So it's both encouraging women to pursue careers in this line of work, as well as ensuring that we're advocating for sufficient leadership opportunities for them. So I think about Dr. Leah Tadesse, who is the Minister of Health in Ethiopia, and the amazing work that she and others in the Ministry of Health and partners in the field are doing to build a national digital health strategy for Ethiopia, and architecture, bringing all these different digital systems together there. And the role model she is, and that work is for others who are interested in this space and who are embarking on similar endeavors. And there are many other examples I could cite of women in leadership positions who are really excelling. But it's notable that when you look across, for example, even in the United States, recently there was a survey of a number of companies that were digital health companies, what percentage of them were women-led, and it was under 10%. That study was a few years ago. Hopefully that number has grown, but this is a global problem, and it's one that we should continue to shine a light on and continue to address, because we know that women in leadership positions deliver value, and we know that when it comes, for example, to health planning, a disproportionate amount of health planning is done by women. And so if we want to unlock the value that women bring, whether that's in leadership positions or in the day-to-day work that they do to support their families, we need to be thinking about how we give women access to digital technologies, and access to leadership positions that enable them to add value at the family level, at the societal level. And we also know that giving women access to digital connectivity unlocks significant financial value at a national scale as well. So there's an economic incentive to include women. So all of these things taken together, I think, show that we are making progress. We have strong leaders who can serve as inspiring examples of the work that women and the value that women can bring to this space, but we need to continue to advocate for women in leadership positions and support one another in that process.
Completely agree. Completely agree. Yeah, and there's something to be said, I think, about AI for the young women perhaps watching this. I was with the Ministry of Health from Burkina Faso recently, and the shortage of people, AI is sort of the big next wave coming. Hopefully we'll get through the interoperability issues here, because until we solve that equation, it'll be difficult to move completely into the AI world. But that's the next big wave, and there's a dire need for more people in this field, and probably in particular in Africa. So that's something to pay attention to. Adele, we've run a little bit out of time here, so I just want to thank you again very much for taking part in this discussion, and also want to wish you all the very best in this sort of new position with USAID that you have. Thank you again.
Thank you.